And thank you everyone for coming along. It's a great privilege to be in this wonderful institution, and my gratitude also goes to the Oxford Internet Institute. But it's really humbling to sort of walk around these halls out here in this beautiful building, and to reflect on the fact that repositories of knowledge like this used to be only accessible to people within the close proximity, or those with the wherewithal and the resources to find their way here and put themselves up and avail themselves of the research possibilities that a collection like this represents. The internet, of course, changed all that and put the knowledge contained in these rooms within the grasp of anyone from my flat in Manchester through to my family back home in New Zealand. The next stage of the internet promises to vastly expand on that experience, and we'll soon be able to visit this museum and stand in the hall out there, maybe even handle the exhibits, feel their weight, their texture in our hands, maybe even smell or taste them, things that we can't even do today out there, copy them for display in our own metaverse environment. Although I have to say I'm less than enthusiastic about the prospect of Madagascan hissing cockroaches occupying my virtual world as much as I am finding one in my kitchen. But I think those speculations aside, the questions of the metaverse, Web 3.0 and the like is for another talk, another time. My topic today in this Centre of Knowledge and Research is the topic of research. I want to briefly acknowledge the Oxford Internet Institute and its foresight. Established way back in 2001, it was an astonishing act of prescience by its founder. And I read a document which I think serves as a biography of the Institute by its founder, Andrew Graham. And in it, when one of the papers he referred to one of the papers he wrote in support of the idea of the Institute. And he said that in that paper, he had emphasized the extent to which all the normal ways of assessing the validity of information were lacking on the internet, and argued that as a consequence, universities in general, and Oxford University in particular, had a huge potential to act as trusted information providers. Once again, how obvious that now seems in an age of misinformation and deep fakes, ChatGPT generated research papers, but how prescient it was to set out that case 20 years ago. And the robust research necessary to back up or debunk false statements, to understand the implications and applications of the internet, is the reason that I'm here today. Data, or data, if you prefer, I'm told one of them is correct, I can never remember which one it is essential to research. And more we are realizing the somewhat sarcastic observation from economist Ronald Coase, who said that if you torture the data for long enough, it will confess to anything. That is now, in fact, coming to pass. A recent study reported in the popular press looked at how tracking what products women bought using supermarket loyalty cards could lead to early diagnoses of ovarian cancer. A team at Imperial College London found a correlation between women's purchases of over-the-counter indigestion tablets or painkillers and a subsequent cancer diagnosis. What other insights are there to be mined and extracted from unexpected sources? What benefits to the public and to the public health are still to be revealed by the kinds of inquiring minds who thought to undertake that analysis? Data protection is a necessary precondition to ensure society gets the benefits of that research in ways that are safe and respectful of the individuals who make up any given data set. As the Information Commissioner, my job is to administer a number of statutes and regulations, including the UK General Data Protection Regulation, as we lovingly refer to it, the GDPR, and the Data Protection Act 2018. These statutes require fairness and transparency in the processing of personal data. They impose qualified prohibitions on using data collected for one purpose for unrelated purposes. And these pieces of legislation are sometimes maligned as getting in the way of innovative data uses, such as research. And it is my mission to ensure that that bit of misinformation is not perpetuated. To get a good academic research outcome requires a number of different strands to come together. You might need ethics, oversight, and approval. You'll have supervision, peer review. These all contribute to the social license and legitimacy and authority of your research. But anyway, I wanted to just add to that mix of that matrix of oversight and enabling authority, data protection. It's part of that matrix and can add to the social license and legitimacy of research, or done badly, can undermine it. Whenever you are sharing data about a case study, arranging workshops or user testing, surveying a population, or repurposing administrative data to see what insights it can yield, data protection law is right there. But rather than getting in the way, data protection laws should give researchers the confidence they need to share data safely and effectively for good public outcomes. For example, during the COVID pandemic, we reacted quickly to reassure organizations that sharing data for research purposes, particularly location data that was properly anonymized and aggregated, was okay. I mentioned earlier that one of the rules in the GDPR is purpose limitation. If you collect your data for one purpose, you can't use it for another purpose. These rules, many of them are subject to exceptions. And of course, research, legitimate research, is one of the exceptions to that prohibition against repurposing. And we published our research guidance provisions back in September. My colleague Ian Hume at the ICO wrote for Research Live that data protection is an enabler, not a blocker to high quality research. A rephrasing of the phrase which I've become known for, if you've listened to me speak in other forums, as GDPR being a how-to, not a don't do. It's a guide rail. At the ICO, we operate a sandbox, a safe place where innovators can test their ideas and identify and mitigate data risks with our help. And in that process, we helped Zamna, an organization focusing on health verification for travel, to ensure that they are transferring sensitive health data in the most privacy-preserving way possible. We've also worked with financial institutions supported by the Home Office on safe ways to share data related to financial crime and money laundering. I want to emphasize again that data protection is not about blocking research. On the contrary, if you can show people that you're committed to high data protection standards and that you'll look after their information, they'll be more likely to trust you and participate in your research, helping you to widen your participation groups and have a more representative sample size. It's not a tick box exercise. It's a way to ensure that your activities are trusted and responsible. But we do also understand that the law can be confusing. I get a lot of mythologizing bubbling up to us. I see it in ministers' offices and secretaries of state and all around the economy, that this law, with its general application, can create uncertainties in the specifics of a particular proposal. And that's why we brought together all of the research provisions within the UK GDPR to create detailed guidance explaining when they apply and what you need to do in order to use them confidently. I want to say to the whole economy, to the research community, that we at the ICO are here to help, not to get in the way. And I would also say that if somebody says to you that you can't undertake that research that you're proposing because of the GDPR, you might want to take another look at it or come to us and check that assumption. What happens when an organization gets it wrong? One example is the GPDPR, which is a bit of a mouthful when you're used to rolling off GDPR. GPDPR was a proposal for general practitioners to upload patient records into the NHS to facilitate a variety of research and monitoring outcomes. And it foundered because it was not sufficiently transparent with GPs and patients. The negative publicity which surrounded that proposal made it look like it would drive such a high opt-out rate as to significantly undermine its utility as a tool. This is my point about, again, needing to have a social license for your work, not just legal compliance. It's not enough for someone to say, we've checked the law, it's fine. You've got to take people with you. And the principles of data protection can really help with that, principally the transparency obligation. Another thing that we've done to assist in this area, because it's really important for research, is to issue guidance on anonymization and pseudonymization, which is a really important part of getting public value from data. And it's important because one of those is personal data subject to the GDPR and the other is not. If you've properly anonymized data, it's not personal data. So the restrictions such as they are don't apply. If it's pseudonymized, it may be vulnerable to attack. Once again, the value of getting this stuff right is probably best illustrated with the negative. There was an attempt in Australia to make publicly available for research a sample of Medicare data in the state of Victoria. And a researcher who had access to this record of apparently anonymized Medicare data of 2.5 million Australians was able to re-identify strings, longitudinal strings from that data set. And the reason was that the way they had anonymized it was to take out the names, right? Fair enough. They also took out the age, the date of birth of the individual data subjects. Now, you might think if you don't have age and date of birth, how do you identify someone from a data set of 2.5 million? Again, to anonymize it, if the data subject had children, the date of birth of the children was anonymized within a month. So instead of the date of birth, it was month of birth. And the researcher found a collaborator who had 3 children, and she put that person's year of birth into the data set and her gender and another feature of the geography, I think, was brought down about 57,000 records. When she added the month of birth of one of her children, that number dropped to about 250. When she added the second month of birth of her second child, she was able to identify that individual from that data set of 2.5 million people. And that means pulling the string of every interaction that person had had with the health sector. So they didn't even need the third child. So that data set was then pulled from public access. Other research I've seen on an anonymized data set had 1 million telecommunications provider records with location data included. And researchers showed that if you knew where someone had been 4 times in a year, you could extract their record with an 85% level of confidence. So that means if I know where you work, I know where you live, I could probably put a gas station and a supermarket somewhere between those in, and voila, I've surveilled every movement of yours in the last year. So the GDPR and our guidance should help avoid these kinds of pitfalls which undermine the legitimacy of research. The help that my office provides doesn't just apply when you're starting on a research portion of your project. We offer a full advice service whether you've got a concrete idea for an innovation or you want to stress test a product or service before taking it to market. And I mentioned the concept of the sandbox earlier. We have this scheme where organizations can enter and explore the data protection considerations of their product or service in that safe space with the expert supervision of our sandbox team on hand to help iron out potential issues or concerns, identifying risks and mitigating them. Following on from that, as one of our commitments within our new 3-year strategy, which we're calling ICO 25, we're introducing a service called Innovation Advice, which will offer fast and frank advice turned around quickly for specific data protection questions, and it won't be powered by ChatGPT. By speedily offering our advice, we're determined to follow that theme of data protection not being a barrier to innovation. We're also keen to look ahead at what's coming down the track to ensure we're on the front foot about any potential data protection issues that we may need to address. We recently released a Tech Horizons report looking at emerging technologies that may come to the fore in the next 2 to 5 years. And we've decided, out of the dozen which we sort of scanned, to focus on consumer health tech, next generation Internet of Things, immersive technologies, and decentralized finance. This will help us avoid, I think, the pitfall, which one of you raised with me before, which was sort of sleepwalking into a new economy of surveillance, which I think data protection authorities around the world did, and which is documented in Shoshana Zuboff's book on surveillance capital. Once you miss the opportunity to shape these technologies, I think you can find that the horse has bolted. Getting ahead early enables us to start discussions with organizations thinking about designing these products or services, ensuring that data protection is baked in from the beginning. We're keen to support organizations and researchers where they are right now, rather than waiting for law reform and offering to help. But in touching on law reform, I should mention that one of the government's objectives with the Data Protection and Digital Information Bill is to make even more clear that information can safely be used for research purposes and to provide clear definitions of research for innovation. Any future reforms, whether in the current bill or any other suggestions which end up on a wish list, should look to increase public trust in innovative uses of data and to enable organizations to comply with the law in the most effective way possible. Just in closing, and so that we can move on to a bit of Q&A, a final offering from me. The legal requirements for research are important, of course. I would say that it's my job to enforce them, and you need to comply with them. But what I hope I've been able to demonstrate today is that it's critically important for researchers to bring the public along with you in any use of data for research purposes. And one way of doing that is by making a virtue out of the GDPR practices, publishing things like your data protection impact assessments and the like. I think that's just about my time. And I hope I've given you an idea of how the ICO, the Information Commissioner's Office, is working to support research and innovation. Of course, there's a whole range of other stuff that we can do that we can move on to now. But I want to leave you with one of the key phrases that appears in our strategy document, ICO 25, which is that the ICO exists to empower you through information, whether you're a researcher, an institution, or an individual whose data may end up being the subject of research. So thank you for coming on. Thank you for tuning in, and I'm happy to hear your questions.